Hello friends, welcome to Tanisha's Health. Knee is the pivotal joint for our everyday activities. It is the most stressed joint in all activities, right from standing, sitting, bending, lifting something, walking to running marathons. Obviously, wear and tear of the joint is easy to happen. So also, knee pain is one of the most commonest complaints, particularly in persons aging 40 and above. It also occurs in younger patients, but the causes are different. Today, we will have a short but explanatory overview about this joint and some aspects of its treatment. Firstly, we will categorize as per age. In younger patients, mainly two causes affect knee. One is some kind of trauma, twisting injury, jerk, etc. It involves single knee pain obviously. It may be associated with pain, swelling, decreased and painful movements on that side. Here we are not discussing about injuries associated with fracture, dislocation, etc. All these pain conditions are better with rest and problematic when the person do some kind of exertion. Second cause is arthritis like picture. It generally affects multiple joints. Structural damages may or may not be present in early stages. X-rays and MRIs may also be normal in early stages. More often, the pain is of inflammatory variety, that is, rest increases the stiffness, like in morning after overnight sleep. These persons find it difficult to stand over legs for few minutes and the joints are eased with some kind of use like walking few steps, hot massages, gentle activity, etc. Now, body is a machine, so it also suffers from wear and tear. When we enter 40s, these maintenance problems start surfacing. It is like graying of hairs which is not having permanent solution. But as it troubles daily activities, it must be treated anyhow. So after 40s, we can categorize causes of knee pain into degeneration and first two causes, that is injury and arthritis, as we have seen in under 40 age group. Now degenerative conditions causes a degeneration of the cartilage, lubricant inside the joint, just like damage of brake shoe, clutch plate and exhaustion of engine oil. So when it happens, knee starts giving pain on use. It may get swollen and water may get accumulated inside the joint. There occurs excess bone growth at the joint surfaces. The joint space is reduced and so also the lubricating oil. These changes make range of movement progressively limited and painful. Now, we grossly know what are the causes of knee pain in different ages. We'll just go through knee structure to understand it better. This is our knee. After skin comes all the muscles which are giving strength to the joint. Muscles are causing movements of the joint also. After the muscles comes ligaments forming outer strength for the joint. These colorful blue structures are bursa or cushions which prevent friction between any two moving structures. Under it comes various ligaments. These are extra-articular, that is outside the joint, and inside the joint, intra-articular. Then comes knee capsule or the actual covering of the joint. It covers the actual joint which is formed by bones, cartilages, internal ligaments and the lubricating oil. You may wonder now, if there are so many structures, what may cause pain? So friends, all structures mentioned above singularly or collectively may contribute pain in knee. Now let's turn to the important aspect of this ailment. What's the treatment? Who is the proper specialist who can treat it? Treatment can be in the form of medicines, simple exercises, physiotherapy, injection in and around the joint, arthroscopy, joint replacement, etc. Obviously, it will depend on the cause of the joint pain. Now you may have got super confused. Where to go for all these? Let's streamline the treatment. There is one faculty who can provide you treatment as a sheet anchor of this multi-speciality approach, and the faculty is pain physician. If you don't know what this pain physician tribe is, I'll shortly put a video on that explaining what pain physician, what they do, in what ailments they are useful for us. He will treat to the scope of his limitations. Otherwise, he will guide you properly what to do next. So what you have to do, you have to search for a pain physician in your city and consult him or her. Now, in early stages, pain relief can be obtained by simple exercises or simple painkillers or medicines like acetaminophen, etc. As we had discussed before, degenerative conditions and arthritis will be causing almost irreversible and progressive damage to the joint. So when the first stage or early stage is over, that means we may need painkiller occasionally, once in a while, or gentle massages, exercise or physiotherapy can make you able to use your joint freely for a certain period of time, say weeks or months. There is early stage. If you need to take painkiller and other medicines daily to maintain your normal activities, then medicine is not the preferred line of treatment for you. Then what to do? We have to go to the second stage of the treatment, and the second stage is getting injections in and around the joint. Here many persons are concerned whether taking injection in the joint is safe, what type of injections are they, will damage the joint further, why not go for joint replacement directly, etc, etc. I'll try to answer all these questions one by one. First one is it safe? Yes, absolutely, but take it from proper pain physician, because they will take utmost care and will know the indications in which patient injections are to be given and which type of injections are to be given. So take it from a proper pain physician only. Second question arises, what type of drugs are used? Are they steroids? The answer is yes and no. Many drugs like lubricant, platelet-rich plasma, prolotherapy, stem cell therapy, ozone and steroids, these can be used to inject in the joint. This will be decided by the treating physician what is best for the joint and for the patient. For how much time we will get pain relief? Well, it depends on the extent of the damage to the joint, bone strength, muscle strength, body weight, activities of the patient, etc. But overall, as per our clinical experience, 1 or 2 sittings of the injections with a specific period apart can give relief for 4 months to up to more than a year. Now, what might be the criteria to exit the second stage? If the patient needs injections 3 or more than 3 in a calendar year, then the injections are not beneficial for his joint and not working for that patient, and the patient has to shift to another treatment regime. Now, what is another treatment regime? You can opt for radiofrequency ablation of the knee joint nerve supply. Radiofrequency ablation is ablating or blocking the nerve supply to the knee joint, 3 nerves out of many nerve supply in the joint, and this will give pain relief from 1 year to up to 4 years. This is also a OPD procedure. This is also an injection like procedure. The patient don't need to get admitted in the hospital, and the pain relief is from 1 to 4 years. So this also can be tried if simple injections in and around joint are not sufficient for the patient. Now the question comes, what is the role of arthroscopy in management of degenerative or arthritic type joints? They definitely have certain role in injury, ligament injury, meniscal tear, etc. In degenerative conditions also, giving joint lavages, repairing the damaged and torn meniscus, etc., arthroscopy can help a lot. Lastly comes joint replacement. Here again the question comes, why not go for joint replacement directly? Let's enumerate the causes for that. Replacement is advised not in early stage of joint disease but in later stages. First thing. Second thing, replacement is generally not performed in early age group unless mandated. It is performed in a later age group. When you reach around 60s, the replacement will be the treatment of choice for you. Third thing, many of the patients may not be affording the cost of the surgery. Fourth thing, many of the patients may be afraid just for the fear of surgery. Fifth thing, many of the patients might be having some other comorbidities, that is other illnesses or other factors which may not be making them fit to undergo the surgery. So few of these factors are decided by the patient, that is these are patient factors, and other factors are decided by the doctor whether the patient is fit for surgery or should undergo joint replacement. So decision is taken depending on all these things. Only aim behind the decision is to give the patient physically capable life using his joints to the extent as far as normal he can use. I hope most of the questions in your mind about knee pain are answered. Let me clarify it to you. The terminologies used in this video are simplified for the reason of understanding of non-medical person. It's only to draw an outline of the disease and its line of treatment in patient's mind. All treatment decisions are to be taken with and after consultation of the concerned faculty only. Keep watching for such concept clearing videos about your health. Do like and subscribe the channel for more such videos. Thanks for watching.